أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته. Hope that everyone's doing well. It is a pleasure and an honor to see everyone here again, and some of you are new. Again, thank you so much for being here. To our program, Soulful Dialogue. It's a program that we try to put together once a month for the community to discuss challenges or individual challenges or familial challenges, and also discuss and talk about diagnoses of different form of psychological habits or behavioral challenges that individuals face, and we try to bring a guest speaker to the program. Today's program we have a very special guest here. Our topic being the uh, doubting disease, which is known as OCD, obsessive compulsive disorder. And for that, we have someone very special who actually specializes in that field. And the reason why it's very important to have individuals who specialize in one or two disorders is extremely rare as well, because in our field, majority of the times, when you also get good clinicians there, it's very hard to find them. And I know Sister Mubeena, who have given her time today to be here with us to discuss and talk about what is OCD and what does that look like in the Muslim community. It's very prevalent. It's just that today we're going to talk about how do you identify it, how do you detect it, and how do you go about it. What are some measures that you can take as individuals to be able to act upon it. Before we get started with the questions, I would like to do a quick bio of Sister Mubeena and give everyone a quick bio. So Sister Mubeena is a licensed clinical social worker who specializes in treatment of OCD and anxiety disorder. She received training in the treatment of OCD at the UCLA OCD Intensive Outpatient Program. She is certified in cognitive behavioral therapy and incorporates mindfulness-based practices, including acceptance and commitment therapy, into treatment. She is involved in the IOCDF Faith and OCD Task Force and advocates for OCD awareness in the Muslim community. She's also based in Redondo Beach, which is also a neighboring city where I was born in Torrance. So just wanted to give a little shout out to that. That being said, welcome, Sister Mubeena. Thank you for being here with us today.
Thank you. It's my pleasure to be here.
Absolutely. So here, we would like to hear more about how would you explain OCD to us?
Right. So OCD is obsessive compulsive disorder. It's a mental health disorder or affliction that affects 2 to 3% of the population worldwide. So if you're at one of our weddings and there's 400 people, I mean, you can do the math, right? There's probably 6-8 people in the room that might have OCD. Thank you. So it affects 2 to 3% of the population worldwide across race, ethnicity, gender, nationality. It is the 4th most commonly diagnosed mental illness in the United States, after things like depression, generalized anxiety disorder, substance use, and we get OCD. So it's fairly common. So with what is OCD, we can just break it down into the word obsessive compulsive disorder. Obsessions are intrusive thoughts that an individual might have. They're with a person who has OCD, they're repetitive, reoccurring thoughts that bring on a sense of anxiety. So even before I get into all that, I'll take a step back. OCD is not a quirk, right? And it's not like a cute little thing. People might say, oh, I'm so OCD, right? I might keep things neat and tidy, or I might wash my hands a little bit more, especially after COVID. That's not OCD. OCD is a mental health affliction that's diagnosable. So going back, intrusive thoughts are present in OCD. So everybody on this planet gets intrusive thoughts. Wali, you might have had intrusive thoughts yourself, right? If you've driven a car, most people that have driven a car have had a thought, what would it be like if I drive this car off a bridge, right? It's a weird and bizarre thought. It's intrusive. We don't want it. But for a person without OCD, they can dismiss that thought. Oh, that's weird. And they just keep driving. I'm not the type of person that would drive my car off a bridge. Or a Muslim might have a thought about blasphemy, right? Let's say a young Muslim person watched the latest Avengers movie, and there was a character in that movie that was a flying uh, a person from outer space, let's say, okay? And the next day they might wake up and say, oh, in that movie, they said that that character was the god of thunder. So did I commit blasphemy for watching that movie? So for a person without OCD, they might get this intrusive thought and they say, no, I think it takes a little bit more to commit blasphemy or shirk. Like, I think I'm good. I think I'm still Muslim. But for a person with OCD, this thought takes on meaning, it brings on anxiety, and they get kind of stuck in this cycle of thinking about that intrusive thought. So that's the obsession. And then there's anxiety that comes along with it. And then there's a compulsion. So a person with OCD will do something, a behavior to get rid of that anxiety. So that's where you see the hand washing, the compulsive checking of stoves, of locks, of doors. A person might also ask for reassurance from their faith leader, like, hey, did I actually commit shirk? So they're not able to dismiss that thought as easily, and then they have an urge to do a compulsive behavior. This happens and they get stuck in a cycle that's repetitive. Every time they get that trigger, they watch a movie or they pray or they drive their car and they get that intrusive thought. That whole cycle will start over again. And it can be quite distressing for somebody experiencing that.
So let me ask you a question on this. I know probably folks that are here, I don't know if you experienced this, but during COVID, right? Everybody was mandated to, wash your hands, get hand sanitizers, have hand sanitizers with you at all times. Just a question for myself. I've been washing my hands a lot lately, and I go through, I would say, at least 3 different small tubes of hand washing that I do every month. I go through them. Usually in the household, I think as a family, my wife uses probably one every month and a half, and I go through 3. Now, do I classify as having OCD, or folks that have created a pattern, right? They've developed a pattern after COVID of excessive washing, or no?
Right. So that's a question, and we can definitely chat later. I can see, but no. In general, I think um, OCD is classified by a rigidity that sets in. I have to wash my hands. Now, Wali, if you were busy and maybe your kid needed something from you, you could probably leave the washing and go take care of your kid or go do whatever you need to do. But for a person with OCD, it's really hard to leave that thing. There's this rigidity, this sense I have to complete this thing. If I don't, something catastrophic can happen.
So what would you say causes that, right? Because let's say, very importantly, if you need to go and cater to your child, but if you are diagnosed with OCD or you have OCD and you're focused at task that's at hand, so what usually causes that, would you say?
That's a good question. I think the brain is a complex thing, and we don't have a clear answer, unfortunately, for that. There's some evidence that shows that it has something to do with a chemical imbalance in the brain. So the frontal lobe here is where all of our critical thinking happens. And in the middle of our brain is where the fear center lives. So that fight, flight, freeze response that, oh, there's a problem, I need to fix it. So there's some evidence that shows that those 2 parts of our brains are not able to communicate so quickly for a person with OCD, but we're not even sure about that. And there's some evidence that shows that there's some genetic factors. They haven't found an OCD gene, unfortunately, but if you have a family member that has OCD, you're more likely to have it. Some evidence shows that it could be trauma. Treatment is not a trauma treatment. I just want to say that very clearly. But a lot of people say, something happened in my life. Now all of a sudden I'm stuck in this cycle. So there could be a lot of things that cause it. I do want to be really clear about one thing. It's to our community. It's not a spiritual issue. People who are practicing have OCD, people who are not practicing have OCD, atheists have OCD, agnostics have OCD, Catholics, Protestants, the Jewish community, all types of people have OCD, and it affects again 2 to 3% of the population regardless. So there's no amount of praying or worship that can necessarily get somebody out of it. Of course, it can help, but it's not a spiritual issue. That is not the cause.
And would you say, but how, in what ways does OCD affect a person's life on a day-to-day, would you say? Or cases that you get, if you can maybe share with us certain different kind of cases that come to you from the Muslim community, right? For our brothers and sisters.
Yeah, and I'll be careful to speak in generalities, so nobody's confidentiality is at risk. But OCD can range from mild to severe. So we see it affecting people's relationships and lives. It can affect people significantly. It can be just a quirk where people just wash their hands more, check locks every once in a while, but it can be severe where it's affecting somebody's life. I've seen it where people are sequestered to a part of their room. If left untreated, OCD can get worse. So the severity can really be significant. And it can affect, like I said, like different aspects of people's lives, their relationships, their work. It can affect their religiosity. OCD, for somebody who's experiencing a subtype of OCD called religious scrupulosity, where they need to find certainty about how they're practicing their faith. Um, OCD can kind of create a whole new religion, a whole new set of fiqh, a whole new set of religious laws and rules that are unattainable. So it can affect how somebody even relates to their deen.
Very interesting. Now, would you say, is the person aware, the person that has OCD, are they fully aware of their symptoms and diagnosis, or usually not? Because I know there's been cases that we usually have come across or we see where families are fully aware of individuals that have OCD, right? Where, for instance, if they have a child, right, they go out with their grandparents, with their parents, with their spouses, and then when they come to the house, it's like, nope, you got to wash. They bathe the child multiple times every time they go out. Now, the individual themselves, are they aware at that time or no? Would you say?
I would say that OCD is usually, a person usually knows something is off. OCD, there's a fancy word, it's called ego dystonic. A person who has these fears, it doesn't align with what they want. People don't want to be washing their hands over and over again. A part of them knows it's illogical and irrational, but there's such a pull and a draw to do it that it's hard to resist. So generally people know, hey, I'm doing something I don't want to do, whether they know it's OCD or not. That comes with like psychoeducation, doing what we're doing now, teaching the community so people can understand it. But usually there's some awareness, hey, this is not what I want to be doing. I want to be more calm. I don't want to be spending my time doing these rituals.
Absolutely. And would you say, based on your experience, how prevalent is OCD in the Muslim community, would you say? I know it's a broad question, but is there a way to explain that? Like,
Yeah. I mean, ask any mental health professional. There's a few of my colleagues here. We experience mental illness as a community, just like every other community, and pretty much the same rates as any other community, right? And that includes OCD. So if we're looking at it from a clinical lens and not a spiritual lens, it's just going to affect the community. I have a lot of Muslim clients, and I speak to just like a lot of other clinicians who need advice, like dealing with Muslims with OCD, and it's really prevalent in our community.
and would you say, is OCD ever mistaken for another disorder? Has that happened where an individual comes to you and they think something else, there's something obvious, there's something going on with them or something wrong, but they come to you saying that they classify it as another issue, where you have to kind of redirect and psychoeducate them. Does that happen often or no?
Yeah, definitely. What I see is like a lot of people think it might be trauma, something happened to them, and they'll try trauma treatments, and it doesn't end up working. A lot of people think I'm just depressed or I'm just anxious. So it oftentimes goes misdiagnosed, and I think that goes back to the more uncommon themes of OCD that we don't hear about so much. Um, OCD is a doubting disease, so people can literally doubt anything. There's even a theme called existential OCD, which is really hard for me to wrap my head around because I'm not like a philosophy person, but people have OCD about their existence, right? Do I really exist? So when there is more these kind of uh, uncommon or not very much talked about themes of OCD, those go undiagnosed and might just people might think they're somebody that's just really stuck on a topic or something or just anxious, but it's actually OCD.
So what you just indicated, and something that kind of caught my attention, is so basically someone who has OCD, there is a change in mood. You're saying as well that comes with it for the individual as they experience OCD.
A change in mood.
Yeah.
So as a person goes through an OCD cycle, they will feel more anxious over time. So it's not a mood disorder in the sense of like a depression where you see a swing of like elevated mood and lower mood, but it used to be classified. OCD used to be classified with anxiety disorders. It's no longer. It now has its own section in the DSM. But there is a lot of anxiety, disgust, all these feelings that come along with it, with a OCD trigger.
So what happens if someone is untreated, like over time? Does the severity of OCD progress as they get older in time, or no?
Yeah. If I can take a step back and explain the OCD cycle, then we can understand why it actually can get worse over time if it's left untreated. So I mentioned a couple times that OCD is cyclical. Um, what happens in an OCD cycle is that somebody gets a trigger. Like, let's take somebody with a contamination OCD. They might feel triggered by touching a doorknob. So the cycle starts with the touching of the doorknob, that's a trigger. And then they get an intrusive thought, those obsessions I mentioned before. That what if I catch a disease and spread it to my family, and it usually ends in a catastrophe. Everybody gets sick and it's all my fault. Somebody gets hurt, right? So that's intrusive thought. The next step in the cycle is that a person will feel a surge of anxiety. It's usually anxiety. It could be fear, worry, anger, overwhelm. Let's just say it's anxiety. They get a surge of anxiety. Now, nobody likes to feel anxious. So a person with OCD will have an urge to do something to get rid of that anxiety. Okay? That's where the compulsion comes in. I need to go wash my hands. I have to go wash my hands. Right? So they'll go wash their hands, and it's usually like in a ritualized way so that their brain at some point clicks and says, okay, now I have certainty that I'm clean. In reality, there is no certainty that you won't get sick and you're clean, but that part of their brain says, no, now we're good. And then they'll get some relief. So the next stage in the cycle after the compulsion is relief. So that's where learning happens in the brain. And that's where the next time that person is presented with that trigger, their brain goes, oh, we know what to do here. You got to go wash your hands in that ritualized way. And if you don't, here's a bunch of anxiety. So that cycle people get stuck on. If you think about checking locks or checking the stove to make sure it's off, you can see people that are in their kitchen for half an hour after they cook, checking and checking again. They feel some relief, they walk away, and then their mind goes, the doubting disease, right? Their mind doubts it. Hey, are you sure you heard that click when you turn the stove off? And then they go back. And people can get stuck for hours doing these rituals. And it gets worse over time because of that learning in the brain. So now if somebody's untreated for years and years and years, now they're washing their hands, they're taking long showers, and the OCD is just kind of spread over all these different areas.
Absolutely, and thank you for explaining that so beautifully. And we will come to questions if anybody has questions after our talk. And again, thank you for explaining that very beautifully, because I think one of the things that we do see is, loved ones, right? Parents or spouses, when they notice that their loved ones are having, or they're always on edge, right? Somebody who has OCD, someone has experienced these symptoms, and it's a constant repetitive pattern that keeps on going, right? Now, how can family members be supportive to individuals or their loved ones, basically, to be able to help them?
Right. This is a big question, and just speaking about it very broadly as like a mental health issue, I think the first step loved ones can do is to help remove the stigma around mental health afflictions and mental illness. Right, our brains are diverse, and people are subject to like different things, and that might be their test. So if you recognize it in a loved one, know that this is just their struggle. This is their test. There's nothing weak about them. There's nothing spiritually wrong about them. And you can do something to help them, even by just sending some compassion to them. Hey, I see what you're going through, and that seems really hard, right? Sitting by them and saying, wow, I've been noticing this is going on. Is everything okay? And not approaching it in a kind of judgmental way. And then for OCD in particular, besides educating ourselves on OCD, being really careful not to become part of the OCD cycle. A person can become part of the compulsion. So if I was afraid that, I didn't turn off the stove, right? I might go to you and say, hey, can you go check if I turn off the stove, or do you smell gas? And now you're part of my OCD cycle, right? So if you know that your loved one is dealing with this, you can say things like, I know this is really hard, and let's get you some help. Or if they're already in therapy, say, what does your therapist say about what you should do in these moments? So removing stigma, providing like compassionate responses and not becoming part of the OCD cycle, getting educated on what your loved one is going through, and providing a ton of compassion in the situation.
And when it comes to someone who actually has OCD, and I think you indicated that, going and having compassion for that individual as a family, and also indicated that that individual, going to a professional, like a therapist who specializes in OCD disorder, what can be done, or what suggestion would you give an individual who has OCD or might question their symptoms, but might have a difficult time taking that step and reaching out for help? How would you, or what suggestions would you give?
So first comes to mind like a message of hope. OCD is very, very treatable. I love what I do because when I learned how to do what I do early on, I saw how quickly people get better, and I love the treatment. That there is a gold standard treatment for OCD that people should seek. It's called exposure and response prevention. It's part of cognitive behavioral therapy. So my job is to expose people to what they're afraid of, and then to keep them from doing their compulsions. And so like I help them go touch that doorknob and then not wash their hands and go eat a sandwich. And it gets a little bit more interesting than that too. So my job is to do that, and in that way we rewire, that's hard to say, rewire the brain so that they don't see those things as threats anymore. So seeking specialized treatment for this mental health affliction in particular is really important, because a non-specialist can actually become part of that OCD cycle, and unfortunately, like without knowing, say things that make the OCD worse. So seeking specialized treatment, and there's a lot of non-Muslim specialists out there who are culturally competent, who can help our community. So even if there's not very many of us Muslim OCD specialists, there's a few out there. But if you can't find one, then going to a non-Muslim and just asking them, like, hey, how would you treat someone like me? I come from this faith background. Would you be able to help?
Thank you for that. And again, this discussion is not going to end here, folks. And again, we have Sister Mubeena here with us. And I also don't want to be the one always asking the questions for today, because I do want to open this space for you as well, for both brothers and the sisters. If anybody has any questions, I would love to, I'd love to see if anybody has any questions. Yes, ma'am.
I will have to repeat again or repeat. Uh, Usually, the example you gave is that of washing the hand. That's why person becomes is having that compulsive behavior to wash. If not, he is fearing not washing his hand. There will be consequences. Now, and you have that treatment. I know you are presenting a treatment. You want to us to identify these people. Now, I think that it is not only in the psychological setup of the person which you have presented, because we have different reactions. I can blame also society. Say, for example, when we have the COVID, we have too much indoctrination that if you not wash your hands, if you will not wash your hands, you will get sick of COVID. So we can blame those people who have this indoctrination. Also in religion, the teaching of too much fear in God will make person neurotic. You know, that compulsive behavior, because it depends on the psychological setup of the person. We are different. Now, you are bringing to us the treatment. And what is the treatment? For me, before we can prevent the occurrence of this OCD, we have to identify the causes. Society, or even the health people here who are indoctrinating about washing, about vaccination, people, many people fear that without washing the hands, without this getting this vaccination, you
Thank
will
you.
get sick of COVID.
Thank you very much. Thank you very much. Thank you for sharing that. Thank you for sharing that. And any other questions? Anybody like to ask a question? From Sister Mubeena, this is your chance. So please don't be shy. Ask your question. There's no wrong questions to be asked. Yes, brother.
Right. So the question was, at what point? Thank you. Oh my gosh, what a sweet young man. Okay, so the question was, at what point does it go from typical doubt to OCD? So from a clinical sense, a person will have to kind of engage in those compulsions for over an hour a day to be diagnosed with OCD. But from a less clinical lens, I think that we're looking for some flexibility in our understanding of how we go about our days, right? A person with OCD wants things to be black and white and very rigid. So if a person is able to essentially leave the doubt and go with what they know, right? That's in our tradition too. Then we kind of see that flexibility. But if a person has to have certainty, I need to know with certainty that this thing is complete, that I won't hurt anyone, that I'm not going to get sick or whatever the catastrophe is, it might be OCD. If somebody has a inkling that they have OCD, my suggestion is like speak to somebody who knows. And a lot of our times, honestly, our faith leaders, our imams, our sheikhs and sheikhas, they're on the front lines and they can help and sense it when somebody has OCD.
Assalamualaikum. That's loud. So we know that somebody who has diagnosable OCD should probably get professional help, because spending hours a day, obsessing about small details is crippling. For people who have obsessive behaviors, not necessarily diagnosable, but certainly obsessive behaviors, in your experience being exposed to seeing these people who may have varying levels of obsessive behaviors on a day-to-day basis, do you have recommendations for a person in how they can kind of support themselves, you know, addressing their behaviors. And to give a small example, there are often times when I know something is what it is, but I have to check regardless. It's not optional for me. I have to check. And it's all, and it's almost a sense of, it's easier for me to check and know than to have to keep wondering. And so I'll check, and sometimes I might check again, but alhamdulillah, it's certainly not spending hours or even many minutes thinking about it. It's kind of like, you know, check and then check again, and that sort of thing. And then certainly mindfulness and the practices that our faith provides us with, alhamdulillah, help tremendously. But in your line of work specifically, in who you're exposed to on a day-to-day basis, have you found that certain practices help people who have tendencies and supporting themselves in their efforts to counter those tendencies?
Yeah, great question. If somebody doesn't maybe meet criteria or need professional clinical help or isn't ready for that, even like any of those cases, what can they do, right? So that's a great question. I think essentially what a person would want to do is to lean into doubt, right? A person with OCD wants certainty over anything really, whatever their OCD is latching onto in that time period. So leaning into doubt. I don't know if this is true or not. It may or may not be true, and I just need to move on. And the moving on piece is where that mindfulness helps. What do I know right now to be true in the moment? What's in front of me, right? Can I focus on something else? Can I focus on my breathing? Can I go make a sandwich? Can I go talk to someone? Whatever the thing is. So leaning into uncertainty and then moving on. And there are a lot of self-help workbooks out there that have all of these concepts. The Khalil Center has put out an Islamic workbook for OCD. There's a bunch of secular workbooks that I can recommend to anybody that wants some recommendations later. And so it's definitely doable if it's a milder form of OCD to work on your own.
Yeah. Okay. Assalamu alaikum. So OCD, the way I'm understanding it, there's when a person have OCD, is that necessarily a bad thing? So like we have the greatest mathematicians, scientists, artists, sports players, they had OCD in their field, right? So where do we find that fine line where being a perfectionist or doing things with ihsan maybe becomes a problem in whatever field that person is in?
Yeah, good question. Perfectionism is, there's a lot of overlap between OCD and perfectionism. So in our tradition, we talk a lot about excellence, don't we? And that's great, right? We should strive for excellence. But for a person with OCD, again, it's that I have to do things to this unattainable standard, and the goalpost will always continually move. So for a person without OCD, they're able to kind of see the nuance in something. You know, if a person, I always use sports analogies, and I don't know sports, but okay, so if a person plays basketball, right? I want to get really good at basketball. I got to do, 20,000, 40,000 hours to become an expert, right? Now, if you make 15,000 hours and then you get busy with life, you might, if you don't have OCD or perfectionism, you go, yeah, it's pretty good enough, I can move on. But when that rigidity sets in, I need to hit 40,000 hours exactly, or else I'm not good enough. That's where it becomes a problem, and that's where it really becomes torture. So what we need to add is a flexibility, a nuanced understanding about it. And I'm happy to dive deeper into that if anybody has further questions.
Assalamu alaikum, and thank you so much for all this incredible information. My question is about, you mentioned that there's a cycle. So I'm curious to know, does it have to be the full cycle? So for example, if there's a person that's driving a car and they get stuck in this intrusive thought, but then nothing happens, but then 2 seconds go by and they get the same thought, and like the whole entire drive, they're getting the thought, but they don't move on to any behavior that deals with it. So where do they stand on this spectrum? Like if the cycle is not complete, is it still OCD or are they stuck in something else?
Great question. So what might be happening that's coming to my mind is a couple of things. Just a barrage of intrusive thoughts, and that's very normal. Like even a person without OCD can get that, and a person with OCD might get that. And if they're ignoring those intrusive thoughts and not doing the compulsions, that's the goal. Eventually, they will hopefully get less intrusive thoughts, or they'll get better at ignoring them. But what might be happening is they're doing a behavior that we call rumination, which is thinking. If you're thinking about the intrusive thought, now you're doing a compulsion. So if you're sitting there and somebody's thinking, oh, did I actually hit somebody? Am I the type of person that would lose focus and not drive? Now you're doing a compulsion, and that can keep you in the OCD cycle. So looking up, if anybody, this resonates with anybody, looking up rumination and learning some skills to get rid of that would be helpful in that case.
Okay, sorry, I had a quick question. Sorry, I'll pass. Earlier you were saying you can get stuck in a cycle to the point where you create a new religion or a sub-religion, and I got really confused by that. Can you elaborate a little bit?
Of course. So one of my favorite topics, being a Muslim OCD therapist, is religious scrupulosity. So this is when OCD latches onto our religion as a theme, or any religion, but let's use ours as an example. So we have a lot of ritualized behaviors in our religion, right? Now OCD will take those ritualized behaviors and make them very rigid, like what I was talking about. So it will take wudu, and we have, I'm not so well versed in fiqh, but let's just say that the rule is you kind of just have to wipe over your arm for wudu, right? Okay, so now we all know you wipe over your arm for wudu, it got wet, you move on. But a person with OCD has to know that they got every inch of their arm for OCD. So now they need to find certainty that every inch of their arm is wet. Now, if you wipe over your arm with water, you check one side, you check the other, then you get a doubt, uh-oh, is that side wet? Now I'm doing wudu over and over and over again. This is a new set of rules. Our religion doesn't have that rule that you need to be certain without any doubt that you got every inch of skin. And so you can kind of extrapolate from there to all of our religious practices. Yeah, I'll be around.
Jazakallah khair for all the good information, but I have 3 questions. Is that okay? Okay, the first one is, do we know the causes of OCD? Like, does it, something happens to a child when he or she grows up, has OCD, or?
This is a quick one. Yeah, we don't know for certain. There is a subtype of OCD called pandas, but that's really rare. So I'm just going to say no.
Okay. How do we recognize the signs of OCD in small children?
Yeah, it could look like a lot of things. It could look like the checking, needing things done a certain way. I need my clothes folded a certain way. So any kind of like things done in a very rigid way, a very orderly way, kids that need to be clean, kids that keep asking the same questions over and over. Basically, if you notice kind of like these repeated doubts over and over and over, I need to know, I need to have things a certain way or else it doesn't feel like, then you might be dealing with OCD. And there's plenty of literature out there. The International OCD Foundation, IOCDF, has information on pediatric OCD and all other forms of OCD.
And the last question I have, how can you get someone with OCD treatment if he refuses, if he or she refuses to get treatment?
What's the saying? How do you force a horse to drink water? right?
How do you get a person with OCD
Yeah.
to go for treatment if he or she refuses to get treatment?
Yeah. So unfortunately, you can't. That's the thing. You can lead a horse to water, but you can't force it to drink, right? You can compassionately make statements, and then a person has to recognize how it's affecting their lives. What happens a lot of times is people accommodate people's OCD, so they'll make their lives easier if they have OCD. So removing accommodations is helpful, and I can speak to anyone more about that after. I know we're pressed for time.
Assalamu alaikum. I have one question with regards to OCD and how it relates to those people that prep or hoard things, and they put a lot of stuff in their cars and their houses and they can't seem to throw anything away. Is that on the same spectrum?
Yeah, OCD, hoarding disorder isn't within the OCD spectrum. It's again, it could be a severe mental illness. It's a mental health affliction that people deal with. Treatment looks similar, but is a little bit different. So getting specialized treatment for hoarding is really important. You know, a lot of our elderly folks, they do like to keep things. But I think we all know when it crosses the line into keeping too much stuff, right? So I know my dad, the garage is full, right? But whether he's diagnosable or not, I think getting a set of clinical eyes on the case might be a good idea.
Thank you.
Thank you so much. Thank you so much. You can put the mic there, sister. We'll come and get it. Again, thank you so much, everyone, for your participation. Sister Mubeena, any last words before we conclude for today? Again, thank you so much for coming here and for expressing and sharing your knowledge, the wealth of knowledge that you have around this topic.
Yeah, no, just I always like to leave with a message of hope. We might know someone with OCD or have it ourselves, and there's so much hope. It's very treatable. And thank you all for having me. This center is very special. There's so much barakah in here. I came in and saw kids playing, and there was an event here, and now there's this. I mean, this is wonderful. So thank you for having me.
Thank you. And again, this is a beautiful community, like all other communities as well. We want to thank you for being here. So please give a big applaud of hand to our speaker. Very informative topic today. Very informative discussion. That being said, again, brothers and sisters, remember we have a program that will continue to partake every month for Soulful Dialogue. So please stay tuned. Make sure interact with us. If there's a specific topic you like us to cover or discuss, a specific topic, please come to me or Sheikh Muhammad. He's always here more than I, so you can't get away from here. But please do let us know, because the programs that we put together and the professionals that we bring on, just like Sister Mubeena here, this is our community. We want the best for our community, and we also want you to give us feedback. Because without your feedback, we won't know what is it that the community really needs and what is it that they are here to hear from us. Again, thank you so much. Jazakallahu khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.